So Mississippi, Louisiana, and Missouri actually have higher firearm death rates. Obviously, there's certain...
What about Chicago?
So I don't live in Chicago. It's not my primary area of research.
You don't have an opinion on that?
I think there's easy access to firearms combined with environmental conditions, lack of great education. There have actually been studies showing that when you green vacant lots and repair abandoned buildings in urban neighborhoods, you see decreases in gunshots, in violence, as well as in stress and depression in the neighborhoods around them.
No disrespect, Doc, but that sounds a lot like word salad to me.
I am a board-certified emergency physician and dean of the Yale School of Public Health. I've spent nearly 20 years working as an emergency physician in a top-tier trauma center. Here in the U.S., treating firearm injuries is a routine part of emergency medicine. During our training, we learn how to identify who must go right to an operating room, how to crack the chest of someone who's bleeding out, and how to notify family members of a death. While in training, though, we rarely, if ever, learn to ask what could be done to prevent a gunshot wound in the first place. That changed for me about 15 years ago, after I cared for a young man, the son of a first responder, who had shot himself with his parents' firearm. He was the first patient I'd cared for who had intentionally shot himself. I couldn't save him, but he changed my perspective on gun violence. First, his death drove me to learn more about firearm suicide, to realize that in the emergency department, we rarely saw suicide attempts from a gun, not because they were rare, but because they were so often fatal. Second, his death led me to question why we didn't think about gunshot wounds the same way we think about drunk driving or heart disease, as something we can and should prevent. Most disturbingly, I noticed the difference in how my colleagues responded to this suicide compared to the everyday toll of community gun violence. Since that case, I have treated people for every type of firearm injury, from domestic violence to victims of drive-bys. I've saved some lives, but not all, and have informed countless families of the loss of their loved ones. And it is because I have had a front row seat to our nation's growing firearm injury epidemic that I have worked to define and implement a public health approach to this crisis. To clarify, this is how a public health approach works. First, we gather data on the problem. How common is it and who is affected? Second, we define risk and protective factors. What increases or decreases the chance of someone being hurt or dying? Third, we figure out programs that work to change those patterns, to avert injury, hospitalization, or death. And finally, we scale what works. America's total number of gun deaths is the highest on record, and our rate nears its peak. Firearm deaths have surpassed breast cancer deaths in America. Firearms are now the leading cause of death for American children age 1 through 19. Although mass shootings get the most media attention, 2/3 of firearm deaths are preventable suicides, averaged over the last decade, like that young man I cared for 15 years ago. I have story after story of public health collaborations between gun owners and non-gun owners, hospital workers and community violence interrupters, faith leaders and survivors. We have shown we can reduce the risk of a shooting long before someone picks up a gun with intent to harm. Through your bipartisan commitment to this public health approach, our country can reduce firearm injury and death for all.
Let me ask you this. In September of this year, our New Mexico governor issued a public health emergency order, and she suspended the right to bear arms in Albuquerque and the surrounding county. Do you support that?
I do not. What I do support is the work that New Mexico has done with...
Do you support that?
No.
You don't? Okay. Let's see. During his first 2 years as the DA in Philadelphia, District Attorney Krasner lost or dropped 47% of all the illegal firearms cases in the city. Do you agree with that?
I'm not a lawyer. I'm a physician and a public health professional. I can say that New Mexico has done amazing work in trying to address the suicide and partner violence.
I'm asking about Philadelphia.
I don't have an opinion.
The DA dropped 47% of all the illegal firearms cases. Did he do the right thing there?
I don't have an opinion. However, I will say that just as with fentanyl, the spread of illicit substances...
I'm sorry to cut you off, but I'm running out of time.
Understood.
The LA District Attorney George Gascon said that he would not prosecute any sentencing enhancements for guns or gang-related activity. Do you think he did the right thing?
Again, I am neither a lawyer nor a prosecutor.
You don't have an opinion on that?
I honestly don't know enough about it to have an opinion.
You don't think gangs should be prosecuted for having illegal guns?
I'm neither a lawyer nor a prosecutor, and that's not my area of research.
But yet you want to take guns away.
I've never said that I want to take guns away.
From law-abiding citizens.
I think that you are saying something that I've not said in my written or oral testimony, sir.
Okay. You equated gun deaths to heart disease in your opening statement.
Yes, sir.
Which is a greater public health problem, gun deaths or heart disease?
So heart disease does kill more folks across the United States, largely in the end of their life.
That's 700,000? Mm-hmm. Yeah. Gun deaths about 50,000?
Correct.
Do you support outlawing fried foods?
I'm sorry. How does that relate to?
Because fried foods contribute to heart disease, don't they?
Again, I have not written or said that I support outlawing.
You're a physician, right?
I am. Have I said that I support outlawing anything in my testimony today?